Finally, some welcome news. From a Center of Disease Control in the United States of America, new guidelines have been released. Center for Disease Control and Prevention's role is protect America's health and safety, and its responsibility is to protect Americans and support communities in this direction. CDC provides health solutions and information to protect the United States against dangerous health threats, and in these times its main role is in the prevention and control of COVID-19. Wow, it has finally happened that CDC has recommended that 70% of people in the United States of America do not need to wear masks or socially distance themselves in public places. In an article from the New York Times, CDC has announced new guidelines suggesting that 70% of all the population can stop wearing masks and do not need to social distance or avoid crowded indoor spaces. Experts have said that the new guidelines were appropriate for the country's current situation. One scientist stated, "We do not need to be operating in emergency mode anymore." Dr. Rochelle Walensky, the CDC's director, stated, "Those who are particularly vulnerable because of their poor health status should take extra precautions. Citizens with a high-risk health problem should use the high-quality N95 respirators to protect themselves from the Omicron variant." An N95 respirator is a respiratory protective device designed to achieve a very close facial fit and very efficient filtration of airborne particles. The Omicron surge has made it clear that vaccinations only provide some protection. The White House has been working on a pandemic exit strategy that would help Americans live with the virus. A growing number of political leaders and health experts are now supporting the new CDC guidelines on restrictions. But there are still many who are very worried about the possibility of the emergence of a new variant of COVID. Health officials have said that common sense would dictate that people with a lowered immunity system, elderly, or other poor health problems should not be risking the possibility of coming in contact with any virus. But to the average person on the street, a chance to get on with a normal life, to be able to go to work, to go shopping, and to socialize, and visit family and friends, and return to normal life and freedoms that existed prior to the COVID epidemic, will be very welcome. We all hope world travel will reopen, families can be reunited, and the confusing and sometimes knee-jerk regulations, some of which were downright strange and ineffective, will quickly disappear, and life will return to normal.